I just wanted to mention, I'll be speaking from the Public Health Agency's perspective in terms of challenges. And ultimately, our main challenge is one that we've heard quite a bit already today, is in terms of trying to work as an integrated whole and to encourage the work of systems. And certainly our big challenge at the agency's level is to, at the national level, how do we define our role in program science given the jurisdictional issues present in our country and the fact that we at the Public Health Agency don't work directly on the ground. Okay, and this is the organizational chart of our agency, and I've just circled the center that Tom and I work in and the RAINR's associated with in the infectious disease branch of our agency. So we're in the Center for Communicable Disease and Infection and Control, and we do deal with a portion of infectious diseases, HIV, other STIs, hepatitis, TB, and some of the healthcare-acquired infections. And the three boxes on the lower left indicate really the more scientific and programmatic portions of our center that deal with external stakeholders that might have relevance then for program science. There's my surveillance and epidemiology division, then there's Tom's professional guidelines and public health practice division, and another division under Jackie Arthur of programs and partnerships with a lot of dealings with the community and external stakeholders there. So we've got within our center an opportunity and some of our own challenges to integrate and work together with these different elements of how we address programming on HIV and STIs. This slide, I was working on in the taxi, didn't get to fill it all in. But, so Sevi, I can appreciate your loss of a slide. I lost. No, actually, I left it blank a bit on purpose because I just wanted to mention that down the left-hand column are a list of activities that RAINR referred to in terms of some of the activities and initiatives we've done that relate to parts of program science. And as you follow them across into the three other columns, which are the main categories of program science, like planning, implementation, and evaluation. And each one of those categories, of course, has many subcategories. Like within planning, there's the resource allocation, which is looking at how to pick from a mix of interventions and how to target those interventions to which populations. And each of these activities could be, we could fill in various X's as we go across to the right. But as Rainer mentioned before, not all of the boxes will be filled in, and so we wouldn't be able to say we conduct program science from beginning to end. But I'll just pick one of these initiatives to look at it in a bit more detail to really highlight the challenges from a public health agency perspective. And that is the looking at enhanced surveillance of HIV-related infections and associated risk behaviors. We have a series of studies across Canada that we support, and we provide financial and technical support for that. The integrated biological behavior surveys among high-risk populations, and we focus on men who have sex with men, injecting drug users, some Aboriginal populations in urban areas, and persons from high-prevalence countries. These surveys are designed and implemented in collaboration with local public health and community groups. So there's very good stakeholder engagement at the beginning, and I think that's one portion of our work that where we're really able to work across different groups and to bring a lot of stakeholders together in a more integrated way. We have standardized protocols and questionnaires just to enhance the ability to make comparisons, but they can be localized to some extent to provide input for local context and to address local needs. So we're trying to allow them to be adapted to fit the local context. And the resulting data has direct value for guiding local program and policy development. Now, really, I should say it has the potential to do that, because I think we have almost the opposite problem that Isaac mentioned. He's got a lot of challenges to address. He says he's lacking data. To some extent, these surveys across Canada have resulted in a lot of data which hasn't been as well utilized as we think it could be. And so we've got data that hasn't really taken the next step in terms of the utilization of that data. And actually, we haven't been able to operationalize that effectively, its use in terms of guiding programs and policies. Which really brings us to the challenges in terms of, our biggest challenge, as I said before, is ensuring the programmatic relevance of these enhanced surveillance studies and really defining our role. And several speakers have mentioned the jurisdictional issues we have in our federal, provincial, territorial environment. Jamie spoke about it as you have your mandate, I have my mandate. And this really is something that hampers a lot of our work. And I think we all feel that. Certainly, if you're not in this certain level of government, you tend to feel, well, that government level is not doing this or not doing that. But even the people in that level of government have their difficulties. And certainly I've had my wrist slapped on more than one occasion, dipping into or crossing a boundary and getting into a different jurisdiction's area of work. We have a challenge with stakeholder engagement. I mentioned that we do work to plan these studies with local community and local public health authorities, and that portion of the work goes very well. But as far as getting to the next steps, sometimes even in terms of analyzing the data and writing a report, and in terms of then utilizing the data and taking action on it, that's where we haven't been able to engage each other that well, and we tend to fall into our silos. And finally, as I mentioned, the knowledge translation and exchange has been a challenge as well. We have the data, we're not that good at translating it and keeping it going down to implement and then to evaluate a program and really use the data in the way that it should be used. So in summary then, our main challenge working in the Public Health Agency of Canada in this area is to really better define our own role within the program science context and to see how our activities and the activities that we support can be better integrated into a system that has benefit for the community that we're trying to help. Thank you.